Assalamualaikum everybody, good morning, good afternoon, wherever you are. I'm Azah. I'm from Department of Biomedical Engineering, Faculty of Engineering, University of Malaya. I've been with the faculty for more than 10 years now, and I did my degree in UIA, Mechatronics Engineering, and then I continued my PhD in University of Sydney, Australia. When I did my PhD, what I learned during my mechatronics degree, I applied into building exercise machine for people with spinal cord injury. So these are paralyzed people who can't use their lower limbs at all. They're in a wheelchair, and I was so inspired by the whole teamwork and the whole impact that the project that I was working on, building that exercise machine using electrical stimulation, was able to make spinal cord injured people who are paralyzed to stand up and walk and cycle. They could even cycle around the campus using only electrical stimulation. So that drives me a lot. At the end of my PhD, I brought back the technology and the know-how, and I set up this lab in Faculty of Engineering. The gist of the work in this lab is rehabilitation engineering, whereby we want to apply engineering knowledge as a solution to help people with disabilities. Rehabilitation means people try to get back to normal life. They try to get back to normal function because of injury, because of illness, because of other diagnoses, which may lead them to end up bedridden or having pressure sore or having a very low quality of life. However, as yet, there has not been much medical intervention that can be done to sustain good quality of life among people who are disabled. People in the medical field have started to talk about technological intervention rather than medical intervention only. So that's where we come in. As biomedical engineers, as mechatronics engineers, we produce solutions, and at the same time we understand the physiology, the anatomy, and the being of people who are disabled. We do have to understand how they feel. We do have to understand how the system works. We do have to understand how the muscle actually functions in order for us to be able to intervene accurately and precisely and functionally. So what we do in our lab, the biggest contribution that I could say is in functional electrical stimulation. Our lab is the leader in functional electrical stimulation in the whole Malaysia. If their devices break down or they need further input on how to optimize the solution, they will come to us. So we have this good collaboration, working collaboration with the patients and the doctors themselves in order for us to provide a good and workable solution so that in the future we could really implement this as part of clinical practice in Malaysia. Biomedical engineering, rehabilitation engineering should not be separated from the medical field as an auxiliary, but it should be incorporated as part of the practice. So we are starting our rehabilitation clinic services as engineers in the hospital as well. So let's talk a little bit more about the research we do in this lab. As I mentioned, electrical stimulation or functional electrical stimulation, we call it FES. That is how we stimulate muscles that are paralyzed. Muscles that has been waiting to be stimulated. The reason they are not stimulated, the reason they are paralyzed is because of, let's say, injury, accidents usually. It breaks or it affects or it breaks their spinal cord. So the brain signal that sends signal to the rest of our body could not reach the lower part of the body. That is why the muscles are asleep. because they are not being awakened by the signal from the brain, because the signal couldn't get passed through the brain, through the spinal cord. However, the muscles itself, they are still healthy, they are still able to function if you provide the right stimulation. So what we do is we provide electrical stimulation through electrodes, and we can control the electrical current in order for us to provide that electrical signal to the muscle directly, and patients will be able to cycle, to extend their legs, and they will be so happy to see their own muscles contracting and bulging because of the electrical stimulation. So with many weeks and sessions of exercise with electrical stimulation, you could really see that their muscle will get bigger, will get healthier, and if you do scans on them, the muscle fiber types will also change to the healthier ones. One of our experiment that we have done in the hospital itself that we are really excited and proud about is the electrical stimulation standing, functional electrical stimulation standing. We were able to make patients or spinal cord injured patients who has been paralyzed for many years, but because by putting electrical stimulation on their muscles, on their legs, they were able to stand up and remind themselves of how tall they are and they could be if they are standing up. They have been in the wheelchair for a long time, and when they stand up, it's a good feeling for us researchers, the clinicians, and for themselves. Some of them, they will bring their wife to take photos of how excited they are to look. I'm standing, you know. So that is the kind of impact that we would like to have delivered more to people in Malaysia. The other thing that we also do is electrical stimulation cycling. This is currently already part of the clinical practice in rehabilitation medicine in Menara Selatan, PPUM, where patients who are paralyzed, they will come with their wheelchair, they will park themselves on the bicycle, electrical stimulation driven bicycles, put their legs on, and they could pedal using electrical stimulation in order to just to pump the blood from the legs up and get them feeling healthy and pink on the legs. So those are some of the achievements that we have done in our lab in terms of improving the clinical benefit for people with spinal cord injury themselves. So what we have done so far, we can be sure that inshallah this will go for a long time, and it will keep increasing and more people will be impacted. We do also build our own electrical stimulation device, where we hope that we do not have to purchase and procure from overseas countries anymore, because we are the inventor themselves. So this, inshallah, in future years we will be able to provide it to the hospitals, and patients can get local access to such technology themselves. In terms of technology for people with stroke, many of Malaysians are affected by stroke, and we see how our own parents, our own elderly at home, their lives change because of stroke. Stroke is where part of the body is affected because there's a blood clot in one side of the body of the brain, which affected the place where it produces movement, or it produces speech, or muscle contraction. So that if the blood clot is in one side, the opposite side of the body will be affected. So you could see patients, elderly patients who get stroke, sometimes they are contractured, they're very hard on contraction. Sometimes they're very flaccid. They can't move, or they can't voluntarily have the same strength as the other side of the body. And the way they walk will be affected, the way they carry themselves will be affected. we understand this. We understand the need that people with stroke would like to have some technology to help them. So in this lab also, we do work on technologies for people with stroke in terms of aphasia, which is difficulty in speaking. When they face difficulty in speaking, the only devices that are available out there are meant for children who are learning to speak. Sometimes they use touch screens, sometimes they use high-end devices that elderly with stroke are not able to catch up and learn and use it optimally. So the clinicians use the very easy way, which is using cardboards. They have pictures of images of eating, toilet, and the elderly with stroke will have to point what they want from the cardboard. So we want to find a solution where it's somewhere in between. It's still technologically assistive, but at the same time not too high-end, so that the elderly with stroke are able to adapt and use it easily. So one of our projects addresses this. So this will be explained by Faiz later in greater depth. We also try to understand how stroke signal from the brain goes to the lower limbs, and at different parts of the brain you get to access different parts of the body, and using not just electrical stimulation but also magnetism to be able to access the right parts of the body in order to activate and perform better rehabilitation. So those are along the lines of stroke rehabilitation that we also do in our lab. The other area that we work on is amputee. We build smart microcontrol transfemoral devices, transfemoral amputee devices, prosthetic devices. So this technology allows people with amputee to wear a type of prosthetic leg depending on how the amputee walks, the way they walk, the way their gait changed. Maybe they want to make some turns, maybe they want to slow down or walk faster. So we built in some microprocessors with sensors in order to detect the requirement and the changes of the gait, so that people with amputation would be able to walk with less effort and energy and perform a healthy, a better walking or better gait, a better living in essence. So those are the area where we also work on amputation, mechanics, gait mechanics, where it is still in progress, but it's looking okay. Another type of intervention that we are starting to explore is the marriage between technology and music. We are working closely with people in music department, where we look at music as a therapy, but with biomechatronics in it. So if you could imagine a robot playing a piano, that's not what we're doing. We use the robotic technology for people with disabilities in order for them to exercise and do training and do physical therapy using music as the foundation. So instead of you getting an elderly with stroke to do, okay, 10 repetition cik ya, 10 repetition, 1, 2, do you think they will come back to the hospital eagerly to do another round of 5 repetition, 10 repetition, 30 repetition once they get back home, and another appointment in 1 month? So the idea is for us to try to make the exercise therapy itself interesting with the aid of technology by itself. So biomechatronics will come in as the hand orthosis or as the understanding how the muscle function, and that's where we explore how music and technology can actually produce something really useful and addresses gaps that has been in the rehabilitation medicine field for a very long time. Following that, we are also working on breathing for people with spinal cord injury. This will be explained more by my student, Imran, a new PhD student, where he will talk about how singing and
Assalamualaikum and hi to everyone. My name is Muhammad Faiz bin Azmi and I'm a master student for Associate Professor Dr. Nur Azah Binti, and my research area is on stroke rehabilitation. Okay. For this research, we did a survey with 60 respondents from National Stroke Association of Malaysia, NASAM, and from the study, we discovered that there are seven functions that they really wanted to be on the device, which is the eat, drink, toilet, thank you, yes and no, as well as the alarm button. For the development, we started a prototype using a Tupperware. This is the first prototype of this device, just using a Tupperware. And then we go through the process of R&D and we came up with something like this, something nicer, but it's still bulky, so it's hard for the patient to use. From the interview that we conduct with the patient cannot hold something that too bulky or too small or too thin, something like iPad. They cannot hold something like that. So we use a Tupperware because it's ergonomically suitable for them. Okay, and then we go to the final stage of R&D. We came up with this final version. Okay, this final prototype has 7 functions, which what the patient want is eat, drink, thank you, toilet, yes, no, and alarm button. And currently we have 3 languages, Chinese, Malay, and English. And they also come with on and off button and volume control. This project started in 2015 as a final year project with Dr. Nur Azah Binti. Okay, the idea is a professor from geriatric medicine, Pusat Perubatan Universiti Malaya, Professor Dr. Pin. She came to Dr. Nur Azah Binti and she requested a device that would help a stroke patient that have aphasia to speak, to converse with other people like us. Okay, now I will demonstrate how to use the device. When a patient want to do something, okay, they just need to press each button that have on top of this device. Let's say if they want to go to the toilet, so they just need to press the toilet button. It's like this.
I want to go to toilet.
If they want to say thank you, for example, just need to press the button.
Thank you.
Okay. Let's say if they want to answer a simple question and answer like yes and no, they just need to press the yes and no button.
No.
Okay. This device also came with 3 languages for now to cater our country diverse culture. We have so far Chinese, we have Bahasa Malaysia, we have Chinese, and we have English. Okay, this is the button to control the volume. You can increase the volume and lower down the volume. The blue button is for alarm button. It's for emergency, for any kind of emergency that need to be used by the patient, like this. Okay. This device can also be used by other speech-related disability, so that we hope this device will cater the needs of the patients that requires a device to speak and continue with their daily life.
Having the right song, the right tempo will actually help as a therapy for them to breathe better. So it's a breathing therapy, but instead of you asking them to breathe using clinically prescribed method, we try to inject some element of fun and element of interesting, and perhaps they were singers themselves before they got injured. Perhaps they could actually sing, and when they are allowed to get back to singing, it brings them back to the years before they were injured, and when they sing, it actually helps them really breathe. So we've done some research on this. Preliminarily, it's looking very positive. We try to put in monitoring system in order for us to quantify how the singing and respiratory function gets better day by day. So that one I'll let Imran to talk more about.
Assalamualaikum and good day to everyone. My name is Muhammad Imran Biramdi. So I'm one of Dr. Azah's PhD student currently. So I'm actually focusing on the research on spinal cord injury, whereby we are trying to find out a new intervention of enhancing the respiratory muscles dysfunction in their trunks and in their necks. So basically, spinal cord injury actually, they have different levels. So the higher the level of the injury, the more severe the injury would be, and more muscles of respiration that are involved in breathing, and anything that has to do with breathing, including singing as well, will be affected. So in this research, we are trying to find out if by singing, because in singing actually we are incorporating a vigorous exercise or vigorous number of repetition of breathing. So if you imagine, if you are singing in a higher tempo or faster tempo of song, you would require a more air to breathe in, right, to support you in the trunk and everything. So that's how we want to incorporate in this research, because we have a lot of muscles that are involved in respiration, not only diaphragm, because diaphragm, we all know diaphragm is the main muscle of breathing. But for spinal cord injury population, they tend to use other muscles as well, because if the muscle of diaphragm is actually affected during the injury, they will actually try to go for another muscles that can be used to breathe. So other than diaphragm, we have neck muscles, we have abdominal muscles, we have trapezius, we have many muscles actually that are involved in breathing other than diaphragm. So basically in this research, we are trying to find out a new intervention of improving the respiratory dysfunction in spinal cord injury population. So with this device called mechanomyogram or MMG, we will be able to detect and monitor the respiratory muscles activity while the patients or the participants are singing. So imagine if this sensor is attached to the muscles that are responsible in breathing, which includes the neck muscle, for example, or the abdominal muscle. So when we attach them and when they are singing, the muscles activity will be seen on the screen of the device itself. So by doing so, we will be able to actually monitor when exactly the muscles will be at the peak of the activity during singing, whether there are any trends of different activity if we are introducing different methods of singing, because singing can be used in different ways. For example, breathing, you can breathe through your neck. Sometimes you can breathe through your abdominal. Sometimes you can breathe through your diaphragm only. So we want to see if we incorporate different techniques. For example, is there any different outcomes later on after the singing therapy in spinal cord injury. So other than the techniques of the singing, we can also incorporate different singing properties like singing tempo or singing beats and everything. So we want to incorporate many things to see whether they will affect the outcomes later on. So this is the screenshot of the activity of the respiratory muscle while they are breathing. So this activity at the highest level is where we measure the amplitude of the muscles activity. So for example, for here and then here also we can see the activity as well while the patients are breathing in, for example. So we by doing so we can see the activity of the muscle throughout the singing therapy. So that's what we are trying to see, whether different intervention can lead to different activity after singing and during singing as well. So yeah.
Assalamualaikum. My name is Nur Azah Binti Hamzaid. I'm currently a PhD student under the supervision of Dr. Nur Azah Binti. So in this lab, we want to make sure that all individuals with disabilities to have healthy lifestyle. So in this lab, we have using functional electrical stimulation for cycling, for standing, for walking, and etc. So for me, my focus of research is during cycling. So I have been involved in this research from my degree year and master and now PhD. So this is the technology of FES. So this is meant to be in for the dynamic contraction but in static position. So as you can see that we have all the cables to connect from electrical setup to the patient. So this is my patient, the healthy patient. So you can see this is for hand activity, and then the patient is at rest and no any voluntary movement. So when I trigger the electrical stimulation, you can see the hand section here as 1, 2, 3. You can see this movement. This is the involuntary movement. This is triggered by the electrical stimulation. So imagine this being applied to the leg muscles for standing, for walking, and for cycling. So we have to first identify which muscles we need to use for each activity. So now I will demonstrate an actual testing session with a user. So we will ask the feedback from the patient, from the user, if he feel pain or discomfort during this session. So now I choose the lower current intensity to the user, and we will see how the feedback and how the response from the muscles. So ready? 1, 2, 3. Do you feel any pain or discomfort? Sakit tak? As you can see, there is no action from the muscles because this is using lower intensity. So I will increase the intensity more, and you will see the difference. Saya terus jam ke 30 1, 2, 3. Sakit tak? Sakit. Selesa tak?
Tak selesa.
Tapi boleh tahan tak?
Boleh.
Tahan. So this is how normally the patient will face. They will feel normally for this user, he feel the sensation but for our patient, the spinal cord injury patient, they have no sensation. So normally they will feel no pain, but they will feel some of them will feel slight discomfort, but some of them will feel nothing. But they feel happy to see there's movement because they are paralyzed before, and if they can see there's slight change of movement, so they will feel very happy. Now I will demonstrate an actual testing session with user number 2. So I will use the same amount of current, which is 10 milliampere and 100 pulse width. This is normally low, but for individuals with disability such as spinal cord injury, we will use higher intensity and higher pulse width because they feel no sensation and they can produce any movement. So that's why we need higher intensity and higher pulse width to trigger the movement. So bear in mind, for healthy individuals, for user number 1 and user number 2, they might have slightly different action and response. Such example, for user number 1, with low intensity, he feels no pain, but with user number 2, he might feel pain. Or for user number 2, with low intensity, the muscle response will be on, but for user number 1, no muscle response. So it depends on the muscle size, the muscle thickness, and the skin thickness, and etc. Okay, so let's start the session. So this is 10 milliampere, very low. Let me know if you feel pain or discomfort. Okay, ready? 1, 2, 3. You feel any pain? No. Okay, I will increase the current to 20. Okay. Takut ke? Ready? 1, 2, 3. Pain? So you can see this is only 20, but the user number 2 shows a response to the intensity. So I will use 30, which is similar to the previous user. You can see the response from the muscle. So this is 30. Let me know if you feel pain. If you feel pain which you can bear, just press this. This is emergency button. Okay? Okay. Ready? 1, 2, 3. Okay?
Okay.
Okay. So in year 2016, our lab have sent a team to Switzerland to participate in a championship which called Cybathlon 2016. So this is what the championship looks like. So we apply FES, electrical stimulation, during cycling to an individual with spinal cord injury. As you can see, spinal cord injury, they can move their leg. So we put this electrode to the leg muscles to produce cycling movement. As you can see here, this is electrode they've been used. Basically, this is a larger electrode compared to this one. So this one is using to the smaller muscles, which is for hands, for example. So for this, electrical stimulation will use to this bike. So this bike is collaborated with the FES system. They connected together to produce a cycling movement, as you can see in this video. So this is wholly moved by the electrical stimulation, not by the muscles. So this is fully controlled by the electrical manually. So the higher the intensity, the more the movement, the larger the movement. But this patient, they have weaker muscle compared to us because of the paralysis. So we have to make sure that the intensity is enough for them to cycle for a certain duration for a certain distance. So in the Cybathlon Championship in 2016, out of 12 teams, we have been in 7th place, which is quite happy for us for the first time participating in that championship. So our goal in the future is to produce functional electrical stimulation device which is smaller, compact, and portable like this. This is currently in production. So we hope to use this to the other applications such as cycling, walking, standing. So this device can be controlled using a handphone instead of computer, because computer is quite a big size, so difficult for us to bring to everywhere. So handphones, like for us, must be easier for us to control the FES.
That's all from our lab and from rehabilitation engineering research. We hope that with these innovations and technologies, we are able to affect and impact the lives of people with disabilities in the long run and for the nation. Thank you for joining us. Feel free to come and visit us. See you next time.